Module 3 will discuss the physical activity guidelines and the definitions for physical activity, exercise, physical fitness, as well as the field of kinesiology and some of the sub-disciplines. First, the physical activity guidelines for the Americans. The 2008 Physical Activity Guidelines for Americans provides scientific-based guidelines to help Americans aged 6 and older improve their health through appropriate physical activity. In particular, the guidelines include the different requirements for the children and adolescents, for adults, older adults, and populations with disabilities, and some other populations like postpartum women. In 2008, the U.S. Department of Health and Human Services issues the Physical Activity Guidelines for the Americans. These guidelines are designed to provide information and guidelines on the types of the amounts of the physical activity that provides substantial health benefits. The main idea behind the guidelines is that regular physical activity participation over the years or the months can produce long-term health benefits. Realizing these benefits requires physical activity each week, and ideally on a daily basis. So here I list the key guidelines for adults because all of us in the class belong to this category. So there are several guidelines for the adults. First, all adults should avoid inactivity. So any kind of physical activity is better than none. So that's the major concept. And two, for substantial health benefit, adults should do at least 150 minutes, which is 2 hours and 30 minutes per week of moderate intensity, or 75 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination moderate and vigorous intensity aerobic activity. In addition, aerobic activity should be performed in episodes of at least 10 minutes, and preferably it should be spread throughout the week. And number 3, for additional and more extensive health benefits, adults should increase their aerobic physical activity to 300 minutes a week of moderate intensity, or 150 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity. Additional health benefits are gained by engaging in physical activity beyond this amount. And lastly, adults should also do muscle strengthening activities that are moderate or high intensity and involve all major muscle groups on 2 or more days a week, as these activities provide additional health benefits. Okay, so those are the key guidelines for the adults, including young adults. So you can think about what you have done in the past week and then determine whether you meet the guidelines or not. After a couple of weeks, we will work on assignments. I will lend some of the monitors to you so you can objectively capture your 1 week physical activity and work on an assignment for that. Physical activity has become an important public health concern these days. About 30 years ago, researchers had suggested that low levels of physical activity were associated with increased risk of heart disease and overall mortality. As you can see from the figure, physical inactivity and a sedentary lifestyle are related to or lead to many chronic diseases, include but not limited to the psychological disorders like depression, mood, anxiety, cancers, breast cancer, colon cancer, lung cancer, metabolic disorders, cardiovascular disease, pulmonary disease, musculoskeletal disorders, Because heart disease is and was a leading cause of death in the United States and European countries for a long time, physical activity emerged as an important public health concern. Therefore, the U.S. Public Health Service initiated surveillance programs to quantify the leisure time physical activity prevalence in the U.S. populations from the 1980s. Alright, here I would like to define physical activity and clarify the difference between physical activity and some similar terminologies. Physical activity is defined as all movement that is produced by the contraction of skeletal muscle and that substantially increase energy expenditure. So there are two parts of physical activity. All movement produced by skeletal muscle and results in energy expenditure. Exercise is planned, structured, repetitive bodily movement. It is done to improve or maintain fitness. Fitness is a multidimensional concept associated with a set of attributes that people have or achieve that relates to the ability to perform physical activity. Okay, as you can see here, there are two types of fitness, which are health-related physical fitness and skill-related physical fitness. In this slide, we show the differences between physical activity and other terms. Okay, we just clarify the differences between physical activity and exercise. Even though the term physical activity and exercise were used interchangeably in the past, we know that they have very different meanings. According to the definitions in the previous slides, we can conclude that all exercise is considered physical activity. However, all physical activity is not exercise. For example, if we walk on the treadmill, swimming in the pool, or run marathons, those are exercise, and all those activities belong to physical activity as well. Okay, if we do yard work in the backyard, or if we carry the boxes upstairs, those are physical activity but not exercise. So keep this in mind. All exercise is considered physical activity, but all physical activity is not exercise. As a result, physical activity intervention efforts should focus on increasing total physical activity and not just increasing exercise. There are some other terms we may need to know. Physical education. Physical education is different from physical activity because it is course taken during the primary and secondary education that encourages psychomotor learning in a play or movement exploration settings. So basically, in physical education class, a student will learn the movement skills and the concept of movement skills and the knowledges, fitness knowledges. Then they may need to, they may enjoy physical activity in physical education class and value this type of activity and will engage in physical activity in a lifetime. Sports is another term that we should know. Sports refers to organized, competitive, entertaining, and skillful activity requiring commitment, strategies, and fair play, in which a winner can be defined as objective means. Okay, so it is also different from physical activity, but from the definition, we can tell that most of the sports belong to physical activity. The other terms like household chores and garden, yard work, those are all on the umbrella of physical activity. In other words, all those are physical activity. For example, when you sweep the floor in the house, or you do the gardening or yard work, you all engage in physical activity. Physical activity, in fact, is a very broad term. Next, I would like to talk about the differences between two types of health-related physical fitness. Okay, as I mentioned previously, physical fitness can either be health-related physical fitness or skill-related physical fitness. Health-related physical fitness encompasses attributes that are thought to be related to improved health, such as reduction in chronic disease, injuries, and rates of disability. It includes 5 major components, as you can see here: aerobic capacity, muscular strength, muscular endurance, flexibility, and body composition. Okay. On the other side, the skill-related physical fitness those most important for successful movement and sports participation. They include balance, agility, coordination, power, and speed. They're also more likely to be determined by genes than by physical activity. They may or may not be related to health outcomes. For example, balance is important for some competitive sports like gymnastics, and it is also critical for preventing the falls in the elderly. Speed is a very important fitness component in track and field, like 100-meter dash. Yet people can be helped without being running really fast. Okay, so that's the major differences between health-related physical fitness and skill-related physical fitness. Alright, so next we talk about the traditional exercise training model. This figure displays how traditional exercise training model has been applied with integration of major exercise science to maximum performance. As we can see clearly from the figure, exercise physiology, movement science, including motor learning, motor control, biomechanics, and exercise psychology. This should be exercise psychology. Are the primary involved in the development of traditional exercise training model. When concepts from this same exercise science are integrated with physical activity, they can also be used to address the public health issues. From the 1990s, the major emphasis has shifted from primarily promoting exercise training and maximum performance to also promoting physical activity for health promotion. The 2008 Physical Activity Guidelines for Americans serve as a benchmark for the integration of kinesiology concepts with public health outcomes. Okay, so here we talk about kinesiology. What is kinesiology? Kinesiology addresses the interrelationship of physiological processes and the anatomy of the body with respect to movement. The study of kinesiology includes a number of sub-disciplines like exercise physiology, movement science, sport exercise psychology, physical education pedagogy, sports management, athletic training, society of sports, physical therapy, athletic training, and special population. Sometimes we call special physical education. In the school kinesiology at the University of Minnesota, we have exercise physiology, movement science, exercise psychology, sociology of sport, sports management, and recreation. Health education and physical education pedagogy were cut a couple of years ago due to low enrollment. Again, in this part, we will focus more on exercise physiology, movement science, and exercise science, because these three primary exercise sciences have been the common integrators for both traditional exercise training models and emerging physical activity and health models. I will skip the details of these three disciplines. as you are all kinesiology majors and have taken those required courses prior to enrolling in this course. Okay, so here are the response questions. What three exercise sciences were primarily involved in the development of the traditional exercise training model? And second, describe your level of physical activity based on your physical activity engagement in the past week. Like, do you participate in moderate physical activity for at least 30 minutes per day? A moderate level can be brisk walking or jogging. Okay. Do you participate in vigorous physical activity for 20 minutes per session 3 times per week?